It's 11 o'clock and 5 o'clock your time. So let me start by telling people who you are so that everyone will know what a privilege it is for you to be sharing your experience with the young people. First of all, just to set the stage, the reason we are doing this is for the benefit of the pharmacy school where we both graduated from, University of Nigeria and Soka, and the young undergraduates who are planning their future. After speaking to them a couple weeks ago, I realized that I can only share my experience. And one of the things I urged them to do was to expand their own worldview. And to do that, I would want them to expand their worldview even beyond my worldview. Unfortunately, I happen to know people like you who are, you are based in the UK and of course have done a lot that I know the students will learn from. So let me just dive into your bio briefly. Dr. Eromona Whiskey is a consultant mental health pharmacist at the South London and Maudsley NHS Foundation Trust and an honorary senior lecturer at the Institute of Pharmaceutical Sciences, King's College London. He has more than 25 years experience in the pharmacotherapy of schizophrenia. Dr. Whiskey is a member of the expert psychopharmacology group of the National Psychosis Service at the South London and Maudsley NHS Foundation Trust at the South London and Maudsley NHS Foundation Trust, and a former head of the National Psychotropic Medicines Information Service at the same institution. Dr. Whiskey is a regular contributor to the highly influential Maudsley prescribing guidelines. His main research interest is in the psychopharmacology of refractory psychotic disorders, an area in which he has published widely. And I happen to have a rather long list of many of your publications, which I will not go into, but clearly people who have interest can look you up and see all the good work you've done. So once again, thank you so much. I'm hoping this will be relaxed, informal, and we'll just chat. And through our chat, people can hear what you have done. So let me just kick off by asking you to share a little bit of how you got to where we were in 1985 when we graduated from the University of Nigeria Faculty of Pharmaceutical Sciences and where you are today. If you could, briefly describe, I call it pathway to success. Can you share a little bit about how you came from there to where you are? Just the highlights.
Oh, Ebere, thank you so much. Actually, it's a real privilege to be able to, share the same platform as you. Can you hear me okay?
No, let me see if it's my audio. Let me raise the volume. Okay, say something.
Can you hear me now?
Yes, better.
Right, okay. I don't know whether it's my own connectivity as well. I'm not sure.
It's fine now.
Anyway, it's fine now.
Yes.
Right, okay. So this is what, from 1985? Goodness me, how many years is that?
I don't want to count. It's many years of
anyway. As a young pharmacist coming out from Nsukka, did my what they call internship in Lagos. I did it in several hospitals in Lagos. And I went up north. I was in Jos. I did my NYC there in hospitals in Jos. Then worked in hospital. And I thought actually that was my future, working in the hospitals in the northern part of Nigeria, right? And then through some very good friends of mine, went into the industry, right? I joined SmithKline, that was in 1988 or 89, I joined SmithKline. And I did quite a lot of travels, mostly in the northern parts of Nigeria.
Did you join SmithKline as a sales rep?
Yes, as a rep.
Okay.
So yes, a background in sales was very useful. Then I left SmithKline in 1993 to go solo. I decided actually, I've had a bit of experience. I wanted to go on my own. But things, things happen for a reason, right? And I don't want to go into a lot of details, right? In 1994, just 1 year after, you remember the presidential elections of 1993, right? Just a year after, I got into some serious difficulties with the security services in Nigeria, ended up, in custody, in the military custody. And things became really, really tough in Nigeria. And I decided actually it was time to leave. So I left Nigeria, in 1994, right, and came to the UK. And that's how my journey in the UK started, right? A friend of mine, we really value voluntary work in the UK, we do. So I did a bit of voluntary work in a psych hospital in the UK. And this is actually the same South London and Maudsley NHS Trust, we're talking about. So, and from there, I went and did the conversion exams. We called it the conversion exams then, right? And only one university in the UK did the conversion exams, the University of Sunderland. Did the exam, passed the exams, and started my pre-registration. This is like my second pre-registration, in the UK, because I did my pre-reg in Nigeria, did another one in the UK. And yes, in 1995, I registered in the UK, and I've practiced in the UK since then. I've worked in psychiatry throughout my time in the UK, and I have loved every aspect of it. So I ended up in psychiatry by accident, right? And I have loved every second of it.
That's such a wonderful thread. And in my opinion, should be encouraging to people coming along, because look at how you had such a tough time that could have just derailed you permanently, but somehow you saw an open door, you went after it, probably not even knowing not really knowing what was behind that open door. Then I'd like to highlight, what you mentioned about voluntary work, because, sometimes when we are in such great need, as well of compensation, of a career move, the last thing we're thinking about is giving something free, because we are looking for so much. But perhaps the voluntary work you did at the same hospital ended up in a way linking you to your next career move. So the question I have, was it the exam, the conversion exam, I think you referred to it. So that's the exam to convert your Nigerian credentials to be qualified in the UK. Was it difficult?
You know what? When I did, it's good to work with dedication. It's good to be the best that you can. I was at the Maudsley for about 4 or 5 months, right? Before the conversion exams. The Maudsley Hospital, where I was doing my this voluntary work, they gave me some stipend for my travel. I wasn't paid. They gave me some money for my travel expenses. They paid £600 for the exams that I did. So I actually didn't pay it from my own pocket. The hospital where I worked paid for it. And I was in Sunderland. I remember Sunderland is, it's in the north of England, right? I remember spending 2 weeks in Sunderland to do these exams. A friend of mine who was, in fact, he was in year 1 when we were in year 5, right? And he was already practicing in the UK. So he was the one that took me through the steps. What needs to be done? This is how the exams are. This is what happens. And he said, Whiskey, don't worry. This is,
you got it.
It's a piece of cake. Tunde Bakare is his name, So I went to Sunderland. I prepared, I probably prepared about maybe 6 to 8 weeks of preparation, of reading, reading that I hadn't done for more than, 10 years. So went back, to go and study pharmacology, what have you, right? And did the exams. Fortunately, I passed it. That pathway doesn't exist anymore. That pathway where you come and you do an exam, you pass the exams, So it's a separate. They have a different pathway now for overseas students. But that was the way it was then. Did the exams, pass, do your pre-reg, and you're registered.
And to the extent that we can you can describe anything you know about the current pathway and the resource, the resource you've provided that I intend to share with the students with more details about the current pathway. But you said that you love what you're doing in psychiatry, and you sound, I could even see from your face that you're enthusiastic. Can you tell us a little bit about what you do, like your current responsibilities, your job, and what exactly you are excited about your job?
Wow, okay. So yesterday, actually, I was at a dinner with a friend of mine. His name is Professor Shergo, Suki Shergo. Right. He's also, he's one of the foremost psychiatrists in the country. So we're having dinner yesterday. And he said, Whiskey, why do you do research? And I said, when you look at the outcomes for patients who have got psychotic illness, when you look at the outcomes, right? And you ask yourself, is this the best that we can do? And you say, no, we can do better, right? And that's the driver. The driver is we can do better, right? So my work is split into clinical. So I do probably about 3 days of clinical work, right? And I work within what we call the National Psychosis Service, right? And the patients that we see within our services are patients who have got an illness that has been treated, but not successfully. So we have a referral pathway from around the country, right? That they refer to our service to say, I've got these patients who has got, schizophrenia for the last 20 years. I've tried everything, and the patient has been in hospital for, 10, 15, 20 years. And so they refer to us, right? So that's one part of my job. The other part of my job is to ask questions, right? Sorry, if I go back one step, I worked in medicines information for many years, right? Medicines information, which is at the Maudsley hospital. And we used to take calls from, psychiatrists, from pharmacists, from nurses, from mental health workers to say, I've got this patient who has got XYZ. I've got this patient who is pregnant, who needs an antidepressant. I've got this patient who has got renal failure or kidney failure and requires an antipsychotic drug. I've got this patient who is catatonic, requires XYZ, right? What do I do, right? And so you ask yourself questions. So one of the and actually that was my pathway into research and writing, the ability to ask questions, to say, how can we do this? What can we do, right? And so a little bit of research, a little bit of clinical work, maybe a little bit of teaching. And so that makes it quite rich. Because I don't know the next patient that is going to walk through the door. I don't know the next question somebody is going to ask me. And so that makes it exciting. You've got to be, you've got to be at the top of your game. You've got to know what research is happening. What are people working on, right? And how can you translate that research into practice? What has been published in the US? What has been published in China? How can you translate that to the care of the patient who is sitting in front of you? And that's what makes it exciting.
It really does sound exciting, especially hearing the way you describe it. In a way, it also sounds it could also sound daunting and intimidating. So can you share with us, how do you stay at the top of your game? Because like you said, when medicines information, in the US, they would call it drug information service. And like you said, you don't know who will call you. You don't know what drug they have a question about. You don't know what psychiatric disorder they may have. So you need to know a lot of things and perhaps also be able to find information quickly. So what is it that enables you do your job well? Is there something you do on a regular basis? Is there a tool that's available to you? Or how do you stay abreast of the knowledge so that you're able to answer all those questions when they come?
So, I mean, the technology is so far advanced, now than when we started. I remember that when I started medicines information, that you wanted to do a Medline search, right? You wanted to do a Medline search, to find out information. You had to ring Switzerland, right? To get a network connection, to get onto the internet, right? You had to ring Switzerland. Well, anybody can access now on a smartphone, right? So technology is very, very much advanced, right? Sources of information, I don't know how students in Nigeria get access to information, right? There are some sources that you need to pay for, right? So the institution where I work, we've got access to everything in terms of information sources, right? And there are filters. So if you go on Google Scholar, for example, right? If you go on Google Scholar, you can set up an alert system, right? Of your area of practice, right? That information, even before it is published in the literature, you already know because Google Scholar would send it to you. And so if you want to be abreast of what is happening, if you want to, I was I was in the ward round today's Saturday, yesterday, right? And one of our patients has got very raised or elevated levels of prolactin, right? And we were looking at, what are the options for this particular patient, right? And
prolactin, you said? Elevated levels of prolactin?
Sorry?
Did you say prolactin?
Yes. Yes. Prolactin level of more than 5,000, right?
Wow.
And I said, yeah, we could use metformin, right? And it was kind of new. This information was new to the team, right? To use metformin to treat prolactin. And so I sent the team all of the references relating to the use of metformin to treat hyperprolactinemia, right? And if you are not on top of the game, if you are not on top of the literature, then your value diminishes. But if you're on top of your game, right, people will look for you. I mean, I stopped working in medicines information about 4 years ago, right? But people still ring me directly, right, to ask for information. Although I don't, and sometimes I would say, please contact medicines information. I don't have the time. Please contact medicines information. And it's because you have access, right? And you've got to make yourself relevant. You've got to raise your stock. And information is power. Information is a power tool, and it's available.
I'm so proud of you. No, I'm not. It's wonderful to see yet another example of how the pursuit of excellence, because everything you're saying is the pursuit of excellence. When you pursue excellence in your work, the recognition and the reward will follow. So, thinking about our audience, these young folks, and reflecting on whether there's anything you got from your background that has given you wisdom to pursue excellence, or perseverance against, I'm sure, challenges, what would you tell a 4th, 5th year pharmacy undergrad about what they should be doing now in preparation for a career opportunity, one, and also the values, because a lot of what you've described are the values that help you actually go after those opportunities. How should a 4th or 5th year pharmacy student begin now to prepare, to position themselves to be able to do what you're doing? And when I say what you're doing, it's not just the job, but how you do it. Any words of wisdom they should be applying at their current level? Is there any building blocks?
I think you must have, firstly, you must have a moral compass, right? You must, know what is right from what is wrong. You must be ready to work hard. I remember in my early years, right? I actually work in medicines information, right? I remember taking a call from a consultant psychiatrist. And she said she didn't want to speak to me. I want to speak to your manager. Right? And, it's one of those things, right? That you said, I am a professional, I'm sure I can help you. And this was probably in my 1st and 2nd year of practice. And so, particularly if you're working within our own, you're working in the UK or, probably similar to you working in the US, right? That you have got to show yourself. You do not want to be at par with your contemporaries, right? You want to be above your contemporaries. If you are somebody who is of color.
So the consultant probably didn't want to speak to you because you were Black?
Yes.
Okay, that's what I assumed.
Or because of the way I spoke.
Mm-hmm.
Right? And so in those early days, I put in a lot of extra hours. Right? You stay back at work, you do extra, you put yourself out. So you've got to put in the hours, you've got to know that you've got to build connections with people. You've got to have the right ethos. And you've got to strive to be the best that you can. Right? And there are opportunities in the field, whether you're working within the industry, whether you're working in the retail pharmacy, wherever you are, right? You want to add value to people's lives. And if you decide actually that I want to add value to somebody's life, I want to make a difference in somebody's life, then you've got it done.
So what I hear you saying is there's no substitute for hard work.
No.
And I really applaud you have to have a moral compass. You have to, just to repeat what you said, know right from wrong and have the courage to do the right thing. Have you had any experience in your career where, and you may not, but I'm just curious, where your values or even your moral compass was challenged? And why I ask this question, many young people today, the peer pressure, taking students, for example, if everybody in your class is cheating on their test, there may be pressure to do the same thing. Otherwise, everybody will do better than you. So translate that to career. In the US, for example, with the opioid epidemic, some pharmacists may want to fill suspicious prescriptions just because if I don't fill it and capture the business, they'll take their prescription to another pharmacist and I'll be losing money. So sometimes you ask yourself, should I bend the rules a little because everybody is doing it? Can you relate to such an example? And what would you say to a student who may be struggling with staying on the right course and doing the right thing, even when it seems foolish, because a lot of people who are doing wrong? Do you have any, can you relate to that in any way?
I can, both in clinical work, in relations with people, in research. One of the things that people would face would be in terms of the integrity of your research, right? And sometimes you can say, oh, goodness me, the easier way would actually be to, the fiddle the figures, or, but you've got, it goes back to what I was saying earlier, right? In terms of having a moral compass. That there will be challenges along the way. There will be decisions that you would make, right? That it's not even about, when I look at certain things that happen now, right? That people have had to pay a very high price for what they did, 10, 20 years ago, right? That people have had to pay sometimes the ultimate price because of misdemeanors, because of things that they have done in the past. I think it highlights the importance of integrity, to be able to say at all times, what I have done with a good conscience, right? What I have done, and it pays because across my path, the people I have come across that have said, Whiskey, I remember that you did this for me 10 or 15 years ago. And actually, I can't remember. And so the seeds that you sow, right? The seeds that you sow come to bear fruits, either good or bad.
That is a good word. That is true. That is true. We see it even outside pharmacy.
Yeah.
People come back, things come back to haunt people. And your good deeds, like in your case, will often be rewarded, even when you have forgotten those good deeds.
Yeah.
You also mentioned about building connections. So, we've spoken about competence, hard work, knowing your stuff. And I imagine that your team is a multidisciplinary team. You work with consultant physicians, psychiatrists, and other healthcare professionals. Is there anything you think you do either naturally because of your personality or maybe even intentionally to build that connection?
I think people will cross your path, right? You will come across people. And it's also part of the kind of sowing of seeds, right? So within my own network, I work with, hematologists, I work with oncologists, I work with, that you come across once, right? And I've heard, in the last, how many years, people who are at the very top of their field, their profession, right? And they're able to kind of help you along. Right? So I don't know whether it is something which is innate or something that you try and build or develop, consciously. But however one looks at it, it's important to build those networks and those connections. And anyone who is coming behind, anyone who is, young, should strive to build those kind of connections. The people that you're going to meet along the way, you don't know who is going to be helpful to you in one way or the other. So in answer to your question, I don't know. I really don't know whether it is something that I don't think that I have consciously tried to do that. It might be part of my nature. The other thing is also to make yourself useful, to acquire skills, right? Because if you've got a set of skills, right, then people will look for you. You and I, we didn't do statistics when we were in school, right? There's a colleague of mine who is in my, in my network, who has got expertise in statistics, right? She's a pharmacist just like myself. She works in mental health services, but she's an expert as a statistician. And if you are doing research, there is no way that you're not going to be a statistician. So she has made herself invaluable, right? So you can also build that networks by the kind of skills and skill sets that you develop. Whether it's in communications, whether it's in, whatever it is that can add value to a group or to a team.
These are such valuable insights. A lot of times, colleagues and even students who live in Nigeria bemoan the lack of opportunities. What do we do? And I know things are really, really hard in places like Nigeria. But sometimes I wonder, because things are hard, there are so many problems and so many unanswered questions. And, so like COVID, for example, during COVID, I think every profession was challenged to think outside the box. And I think in many regards, what we did in Nigeria was ahead of many so-called developed countries. So in a way, there were things to be learned from some of our practices, like even the protocol when you exit and enter Nigeria. Nigeria was definitely checking long before the US started doing anything. So there was something to be learned from Nigeria, as well as some questions to understand why COVID did not wreak havoc like some people predicted, just research. Like, I mean, I remain curious. Why didn't we see the cases? Yes, it's the grace of God and we are thankful. Yeah. But is there anything that we could learn to, that we could use in the future? So I echo, finding a niche where you're either uniquely positioned or desire for expertise, like your pharmacist colleague who has skills in statistics. I'm just curious, your practice, how was it affected by COVID? Because especially in psychiatry, clearly the workload, COVID didn't help. Even people who were not diagnosed were struggling. And I imagine many of your patients would have had an even harder time. Did you have to change how you do your work? What was the impact of COVID on your professional life?
Wow. It's looking in hopefully the rear mirror now.
Fingers crossed.
COVID times were really tough times. That just like it was in the US, as it was here, COVID disproportionately affected Black people, right? So there were, lots and lots of health professionals who lost their lives during the first wave, right? So I lost, people, right? People that I knew who died from COVID. In terms of work was different, right? So we had to split the team into groups, right? So we didn't have 5-day working weeks. I worked 3 days, right? I worked 3 very long days, right? And so this was to reduce the contact, right, between individuals, so that once COVID struck, it wouldn't, decimate the whole workforce. So we had a different way of working. And of course, this whole Zoom and Teams, there was a different model of work, right? So I didn't have to be on the ward all the time, right? We had meetings by Zoom and, learning to share your screen and all of that.
We all became techies by force.
Oh, of course. So there were good things and there were bad things, right? You mentioned COVID in Nigeria. One of the things I did our trust vitamin D protocols, right? Perhaps one of the reasons why COVID didn't result in a higher level of mortality in Nigeria and in fact in Africa might in some way be related to vitamin D, right? It's not the only thing. There's probably a lot of different reasons, right? But it may be one of them, because there is some data that people who had low vitamin D levels were more likely to suffer severe consequences of COVID, right? And many of us who have got melanin, right, had low vitamin D levels. So you can see the correlation, right? So who knows? There may be several reasons, but low vitamin D levels in Black people who are in Europe and in the US might account in some way for some of the higher mortality that we saw. Whereas in Africa, you got sunshine, compared to us. I'm looking out of my window and it's, dreary and dark and dull and, So yes, COVID also, there was a lot of opportunities for work related to COVID. I've got about 3 or 4 publications relating to COVID, right, in mental health patients. Because we also saw higher levels of anxiety, higher levels of depression, higher levels of, psychiatric morbidity related to COVID. It was an opportunity in a way, and also on the downside, there were lots and lots of negative. People lost their earnings, people lost work, people lost, so many things. And so, yes, there was the good, the bad, and the ugly that came with the COVID. But, it was an opportunity to work in a slightly different way. And looking back now, I think, well, actually, I want to work 1 or 2 days from home. I like it.
Wow, thank you. I'm going to switch soon. This is my last question before we talk a little bit, to the extent that we can, about registration in the US, because I want to make sure I don't keep you too long. But, as you were speaking and referencing your publications in progress, it reminds me to ask you, how did you learn to write? Because I think that communication skills, verbal, written, what have you, are often instrumental to enhancing one's career. So to have the knowledge is one thing, to be able to communicate it is another level of excellence. With all the publications you have, with, I'm sure, the talks that you give, how did you hone your communication skills? And what can you tell a young man or woman who feels a little less confident about where they are today? Is it something they can improve? And if so, what, any tips for communication skills?
I think, firstly, the foundation needs to be there. And the foundation is reading.
Reading.
Yes.
Bingo.
That's the foundation. The foundation is reading. You must be able to read and read very widely. Right? I remember when my kids were young, and they were in school, right? And the headmaster used to tell them about 3 hours, right? The 3 hours were reading, 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 right? That's what I used to tell my kids. And so I think communication is really vital, right? And if you are going to make progress, you need the ability to be able to speak and to speak to diverse audience, right? So that's the bedrock. The bedrock is reading. And you've got to start from somewhere, right? You've got to start from somewhere. I remember, actually, one of the most influential people, right, that I always give credit is my boss, Professor David Taylor, right? And David was brutal, right? You would write something, right? And he's got a red pen, and he's got this red pen scribbled across all you've written, and you want to weep, right? And David would say, I'm going to jump from the window. What you've written is so bad, I'm going to jump. So you need mentors, you need somebody, right, to be able to show you. But you've got to start from somewhere. Before you start thinking about doing the meta-analysis, before you start thinking of doing something very big, you got to start from somewhere, right? Whether it's, a half a page, whether it's, And I've got quite, I've got many junior pharmacists that I work with, right? That I supervise, right? That I encourage, just like somebody has encouraged me. One of the guys in my network, he's going to finish his PhD very soon, actually. He's done, in the last 2-3 years, he's probably got like, 15 or 20 publications in the last 3 years, right? Very versatile young man. And in Nigeria as well, actually. So firstly, you've got to read and read widely, right? Secondly, you've got to have a mentor, somebody who is willing to invest a little bit of time in you, right? And to show you, right? And David used to say, Whiskey, what do you want to say? You say it, right? Say it out loud, right? When you write something down, read it out loud. How does it sound to you? So yes.
I can so relate. I had a similar, my major professors, we call them, was like your David. I had one of the times we submitted an abstract to, I think it was for a presentation or a publication, I don't remember, but it was a 100-word abstract. And I got so frustrated one day. I said to him, his name, Dr. Thomas, I said, Dr. Thomas, have you noticed that the 28th revision looks a lot like the 3rd revision? We've been going back and forth from revision number 3 to revision number 28. And we were, I think, at 30 at that time. Like, what are we doing? How much can you change 100 words? And he said, we are pursuing excellence.
Hey, love him.
So read.
Yes.
Get yourself a mentor who is willing to invest time in you and go the long haul with you, tell you when you're not there yet. Of course, have the humility and the patience to listen to your mentor. And actually, that very practical tip, because I use it for my children too, and I do it too. Because sometimes you write something and somebody say, what are you trying to say?
Mm-hmm.
And then you say it, they say, okay, write it just like you said it.
Yep.
It's clear when you say it, but when you write it, yeah. So I hear you. So in the last couple or so minutes, and please, if there's more information that you wish to share, it doesn't have to be a response to a question, but you mentioned you're mentoring a number of younger pharmacists. I imagine many or some of them will have graduated from UK institutions, but to the extent that you are aware of people who are coming from outside the UK, is there still a path? And if so, how does one get information about the path of an overseas trained pharmacist into the UK? And if I just to acknowledge that you sent me a very valuable resource that I will attach as a link when I share this with people, because it's a lot of YouTube videos on different aspects of translating your credentials to and practicing in the UK. But anything else you could share to help those who are trying to come from Nigeria to practice pharmacy in the UK?
I think that if, as a young person who is in university and you think that actually the future of practice for you lies outside of Nigeria, whether it's in the US or in the UK, I think the advice would be to start early. All right, to start early, make contacts. In the UK, now we've got like an overseas pharmacist assessment program, right? overseas pharmacist assessment programs, which didn't exist, when I did my registration in the UK, So they acknowledge that, yes, we need manpower. In fact, there was a time in the UK, some years ago, maybe about 10 years ago, we were recruiting pharmacists from Europe who couldn't speak English very well, right? And so, I was surprised that, if you are coming from Nigeria, you need tests of English, right? You need to, prove your ability to speak English. I don't know what it's called, TOEFL or something.
TOEFL, yes.
Which is, yes.
Test of English as a foreign language.
Yes, test of English. English is not, So you need that. And there are, quite unlike my time where, you could, just go and sit an exam. You need this 1 year, right, of, school to be able to qualify to do this exam. So you need to spend 1 year. And there are several universities in the UK now that do that, right? In my time, it was just one university. There's many universities that do it. So you got to have an idea of the universities that do it. You've got to have an idea of what is going to cost. I think that, the cost for the 1 year tuition is something in the region of about between 12 to 15,000, I think, pounds. You've got to look at how much you're going to require in terms of your living expenses, accommodation, feeding, and what have you, right? So you've got to factor in the costs. That's what I'm saying, right? It's not it's not something which is, so however you want to do that, you've got to factor in the cost.
Is the demand?
The pathway is there.
Go ahead, please. No, you go ahead.
I said that the pathway is reasonably clear. Pharmacy in the UK is, I think 99% of pharmacists in the UK would get a job.
That was going to be my question.
Okay, so I am not aware of a pharmacist who is unemployed. So
if you invest, you will likely get a job.
There are multiple pathways in retail pharmacy, if you're interested in retail pharmacy, in hospital pharmacy, if you're interested in hospital pharmacy, in industry, there's different pathways available for people. I think preparation is the key. Start early. You need to sort out finance and to know which universities you are thinking of, applying to.
Great. Thank you so much. I have thoroughly enjoyed this myself. I could keep talking for 1 more hour. I could keep you talking for 1 more hour.
Goodness, we've talked for an hour, almost an hour.
But I think it's going to be very valuable. So I really appreciate your willingness to do this. And I know that you have indicated a willingness to help in any way you can. So if there are additional questions on this particular subject about the UK, I hope you don't mind that we will come back to you. But Whiskey, thank you so much for spending your Saturday afternoon just sharing.
I thoroughly enjoyed myself, Ebere. And it's good to see you.
We'll do it again. So thank you.
Thank you so much.
Have a good rest of your weekend.
Thanks.
All right, bye.